everyone. This is our weekly meeting with our residents. Today we have Marcus here. Marcus is a PhD student from Baptist Medical University in Hong Kong, which has the largest Chinese medical
research faculty
outside of mainland China.
In Asia.
In Asia. And so Marcus will be here for 6 months. He's finishing his PhD here. So we thought we'd put him on camera and have him ask a question and see what we can come up with. So Marcus, what's the question?
Thanks, Bob. I'd like to ask you the following. I see that you run such a large practice here, and I heard it's the largest in the United States. So my question really is, what's the system behind it? How do you run it? How do you do your clinic management?
Okay, the main thing to understand is that, in my opinion, even if you're good at this, even if you're really brilliant at the medicine itself, it will not necessarily at all guarantee that you will be successful financially in your business. Oddly enough, if you fix people, they'll tell others, but how large the clinic will get based on simply word of mouth and by being good at your medicine is dubious. I ran a clinic here, I've been in business for 16 years, and we built it up to about 25 people a day to maybe 30, so about 125 to 150 people a day, myself and my wife. And then we just hit a plateau. We couldn't get it any bigger. And that was simply treating people as they came and, treating them, having them pay each time they came. And just, by trying to deliver a great deal of service. And it became obvious to me that I was stuck in this 125 to 150 a week realm. And so I just did some research on people who teach, or these sort of, there are people in the business of giving advice to medical clinics, chiropractic clinics and others, showing them how to organize their clinic in a better way. And we used one of these outfits. That was the David Singer organization. And it's really very simple. They just said, well, you don't have a problem with new patients. You're getting 5, 6, 7, 8 new patients a week. Your problem is you're never able to complete your treatment. You're only treating maybe 10 times and then the patient's gone. So you're not adhering the patient to you so that you can actually do what the medicine's meant to do, which is, of course, to really turn someone's health completely around. And he was right. And so what we engaged in is a program of providing financial incentives for people to actually complete a program of care. So we first of all had to develop a program of care. We had to look at how many visits does it take to fix a certain amount of problems, how much herbs does it take, how many herbal visits does it take, and so forth. And then our incentive was that if the patient pays in advance, we provided a great deal of a financial discount to the people. And this was the key. And within about 6 weeks, we went to 300 people a week. And then we went to 400, 500, and we averaged between 500 and 600 a week. And we've been doing that now for 10 years. So it is not an experiment. This is a method that works, and it works continuously. And it's the best way to help a patient, because in Chinese medicine in the United States, there is no placebo amongst the general population towards this medicine. There's no belief. There's no indigenous belief about Chinese medicine like there is in China. So when someone pays you $3,000 or $4,000 for care and saves himself $1,000 or more, they basically commit to the plan because they committed financially. And when they commit financially, then you get a placebo effect, which is about 33%.
Okay.
And that 33% is extremely helpful. And then also people who pay for a plan, they will most likely complete the plan. So now you have a chance to do what the medicine was really meant to do, which is significantly alter or improve the state of health of an individual. So we quickly moved from a Band-Aid, what I call a Band-Aid clinic, where we're just treating, elbows and knees a few times, and then the elbow feels better and the patient's gone,
Right.
to actually treating their diabetes, their blood pressure, all their pains, their anxiety, their depression, the fatigue. Practicing this way is extremely fulfilling because you're able to use the medicine for which it was meant to. It was the emperor's medicine. It was the medicine given to the emperors of China, and it was meant to keep the emperor alive for 100 years. It's a longevity medicine straight up, but that's not how it's being practiced, either in the United States or in China. The Chinese are running Band-Aid clinics too. You're going there and they're treating your back or your elbow, but the entire full force of the medicine isn't coming to effect because in China you either have an acupuncture clinic or you have an herbal practice, but you don't have both under the same roof. So you don't get the full blast of what the medicine will do. Right. This clinic, we're doing everything you can think of. We do Tweenaw, we do nutritional counseling, we do weight loss. And of course, we do acupuncture, we do herbal consultations, and we give out a lot of herbs. We fill 100 prescriptions a day in this clinic. So when a patient comes in with 10 major problems, 6 or 7 of them are usually treated with herbs, and all the pain is treated with the acupuncture. Okay. And so that's basically how we do it. And it works. It really does work. It's very fulfilling to practice in this manner. And then also, you don't have to talk about money. You only have to talk about it once. Mm-hmm. And then the money issue's over. And then it's just a matter of trying to help the patient. And we also give away a lot of free care. I mean, they pay us, and then we end up giving them a lot of free visits during their course of care. And we do that because we just don't want the patient to leave, without feeling a lot better. So we want to do everything in our power to help the patient while they're during their program. Does that answer the question?
Yeah, that's pretty much it. Yeah, I'm very surprised of the sheer number of people that run through your clinic, so that explains a lot, yeah.
It's odd to have such a volume in a small village. I mean, the village of Paulsbo is about 7,000 people. And I think to date we have about 14,000 patients. So we're getting patients from all over the place. But by laying out a course of treatment, laying out a plan for the patient is extremely important. So they know, okay, I'm going to do these many visits, I'm going to have these things treated, and I expect these outcomes. In the beginning, what we do when the patient comes, we do 4 visits. Not anymore, because sometimes people do not respond. So the first visit is a medical history visit, which is what we know what that is. And then their next visit is acupuncture. And we do 3 acupuncture visits, usually 3 days in a row, to see what the response rate is. And based on their response rate, we lay out a program for them on their 4th visit. And they either commit to the plan or they don't. Mm-hmm. And so the kind of patients we have are people who committed to plans. So we have a highly motivated patient load in the clinic. I mean, these are people that really want to get better and committed to getting better. So it's a lot of fun to practice because you're not drained by people who don't even want to be here. Gotcha. It is extremely draining to your energy to have to talk someone into coming back every single time. And if you see 15 people a day and you have to talk all 15 of them into coming back
every single time,
you are totally exhausted at the end of the day. Yeah. I'm energized. I mean, I feel pretty good at the end of the day, and I personally will see 60 people. My residents see the other ones. So anyway, hopefully that sort of paints a picture. I teach practice management on our website. You can watch that webinar, which is, I think it's called Practice Management.
Yeah, Clinic Management.
Clinic Management. Watch it. I go through in detail every single thing that I do. So folks, have a nice week, and we'll see you next time, okay? Bye-bye.